we have so much trust in our regular physicians that they know what's best for us. But why isn't that profession getting it done in terms of our wellness, and instead of what they do is cover up symptoms basically with medication and send you on the way?
Two reasons. One is training and money. The people who determine the guidelines or the clinical practice guidelines for medical doctors are people who sell pills. Every single thing is based on a pill, and so they get trained that way. They also they're trained in an erroneous paradigm that they start with the presupposition that if a patient comes and gets sick, that what they look for is the defect. So when you get a diagnosis of high blood pressure, they're basically telling you, we found out what your defect is. You can't regulate your own blood pressure. They don't say, we found out what your defect is. Your lifestyle is terrible. You're under an enormous amount of emotional stress. You haven't exercised in 10 years, and your food choices are absolutely shocking, toxic and deficient in any proper nutrients. We found your problem. They don't even mention that. They say, we found your problem. You can't regulate your own blood pressure. This pill can do it for you. Because as soon as they get that diagnosis, they can go to a chart called the Framingham chart, and it'll tell you if blood pressure is above this, give this pill. If cholesterol is above this, give this pill. If blood sugar is above this, give this pill. So they're indoctrinated from the very beginning. First of all, two things. The first is the belief system that people are sick because of inborn errors, not lifestyle choices, bad genes or inability to self-regulate. And the second one is the only way to take care of that is with a drug, because people are defective, so they'll never get better. All we can do is try and palliate the symptoms or try and reduce that risk factor with a drug. They don't even have the goal of finding the actual cause of the problem. They don't even look for it. Nor do they think that people can heal, because they think that chronic illness is an inborn error. So they can only treat an illness, not, right? So the definition of incurable is drugs didn't fix you, literally. So how absurd is that? You get an illness because of lifestyle. You take a drug which never addresses the problem, and you don't get better. So in their definition, you're incurable.